Radu Ganescu, welcome to the interview and thanks for taking the time to do it. Tell us a little about how the COVID vaccine campaign has been going in your country, Romania.
When we started to vaccinate it with COVID in the beginning of the year, like late December and early January, practically we were the first country with the highest rate of vaccination in January, February, March, where we were in a positive trend and everyone wanted to be vaccinated. And you know, we had exactly like the other countries, some stage with the doctors and healthcare professionals in the beginning, and after that with the chronic patient and elderly. But after 6 months, everything starts to decline, and it was like a relaxation for everyone, and the vaccine rate starting decreasing very low. And it's happening something else. Everyone that didn't have been vaccinated before started to have some question about the vaccine, because the communication of the government was very poor. And practically we had the prime minister and the president of the country in June telling us that every restriction is on standby, so we win with the pandemic, everything it's okay. So these messages that they transmitted practically was a relaxation for everyone. And after that was very difficult for the government to communicate with the people, to make them understand that the vaccine is important and it's not, pandemic is not stopped for the moment. And that's why we had in September and October the 4th wave that was practically the biggest in Romania, and I think was the biggest in Europe, because other countries had not so high rate of infection and people that die because of COVID. So the first was something that people understand, that it's important to be vaccinated and it's important to protect yourself. And not only the children could be vaccinated, and also the growing people and the adults and the elderly, especially, or the chronic. And it was something that they started to understand, that it's important to be vaccinated for all life period. But in the same time, they did say, okay, so the only vaccine that the people should do, it's flu vaccine and COVID vaccine, and this is it. And that is because the discussion, the communication with the people in general was very poor about vaccination, about the other kind of vaccine, about pneumococcal vaccine, that for me was very important. And I had a lot of material in this time for the chronic patient to have not only the COVID vaccine, but also the pneumococcal vaccine. And the meningococcal vaccine is the other very important vaccine, and many others. And it's something new for us. For Romanian people, it's something new. We don't have education in this area, and we didn't discuss for the last 30 years about vaccination only for kids vaccine. And what is important, and even there, the rate of vaccination for kids it's kind of low. And that's why if you don't vaccinate your child, for sure you will not be vaccinated for yourself. So it's an issue of education that we need to do it. And it started now with the pandemic, because it was a discussion about vaccine that adults should do it in the long life period. In Romania, it's a special case. But if we look in Europe, we'll see that the people understand the importance of vaccination. And even the governments and authorities, they understand that it's important to have national programs of vaccination for long life period. So it was, I think, the only positive thing that we can take it from these pandemic times. And the other parts, I think it needs from now for long term to have education, to have information, to have authorities dedicated to make policy, health policy with prevention package, with vaccination package, and especially to have for the people that are at risk, chronic people and elderly people. They should have dedicated programs for them, if you ask me. Should make it very easy and very efficient for someone to go to the GP or go to the pharmacy, take the vaccine and do it. And now we have in Romania an important discussion, if you ask me, about vaccination in pharmacy. It's something that also was summarized because of the COVID vaccination and how it needs to work something for long term and something very easy as a circuit of the patient, as a circuit of every citizen in the end, because you don't need to be a patient to be vaccinated. So it's another discussion that's been brought out from this pandemic about the vaccination in pharmacy. So I think now we'll start the debate, we'll start the discussion, and probably we'll start to make some national programs not only in Romania, maybe more other countries, like especially in East Europe, where the rate of vaccination is kind of low. And it's important to learn, because if we learn something from this pandemic, maybe we can be prepared in the future. Maybe we can have the necessary measurement or the management to be able to have it more, let's say, with not so many risks for the citizen, with not so many rate of infection, with not so many patients or people that are not informed, and they put their own life in risk.
Thank you so much, Radu. I think that's quite clear, and hopefully, as you say, something positive might also come from a difficult period.